First thing I want people to know is they should know where to turn their power off and their gas off, and these are usually on the side of the house and where the gas line and the electrical lines come in. And certainly if you smell gas, you should turn your gas off and call 911 because that's an emergency. Even if you don't have gas or electric, you need to go and shut the lever down in the off position because you never know when the electrical is going to be restored. The next thing you have to be concerned about is who should be doing the cleanup. And it should be healthy people and not individuals with chronic illnesses, particularly things like diabetes, kidney disease, patients on dialysis, patients with chronic lung disease. For diabetics, just a minor puncture wound to the foot could result in a severe infection that in itself could result in amputation of a toe or the foot or the entire leg. So certainly elderly patients, patients with chronic disease, and kids should not be involved in the cleanup. So that's who should be doing it. What should you wear to protect yourself? Well, you certainly should be wearing good shoes, steel-toed shoes. I learned that when I worked on the railroad. You should also be wearing blue jeans, long pants, not shorts and a sleeveless shirt, and you should also be wearing eye protection. Eye protection is very important because you never know what's going to fall on you or pop out. People should be wearing gloves to protect their hands because of the things that you're going to be doing with your hands. You're going to be pulling boards that may have nails in them. You might be using power tools. And let's talk about power tools for a minute. If you're not accustomed to using a chainsaw and you don't recognize the fact that when you first cut in to wood with a chainsaw, it can kick back on you and you can lose control. So a chainsaw should be held in two hands. A chainsaw should only be used by experienced people who've used them a lot before. They're not meant to be hung in a tree on a rope, which I've seen done. They're not meant to be used with one hand. They're meant to be used by experts and by people who can control the equipment. Because if you lose control of equipment like a power saw, it can essentially creep on the ground and jump up in the air and actually harm other people. And we've seen that certainly in the trauma ICU here. You also need to realize that you're likely not going to have power, or your power is going to be shut off either by you or a neighbor or Entergy, and you need to recognize that you'll be bringing gasoline in to power your tools or to power a generator. And when you do that, you need to realize that gasoline produces carbon monoxide fumes. So anytime you're using a generator, that needs to be outside and not inside. It needs to be in a well-ventilated place. And another thing that's important to recognize is that gasoline is very dangerous. Gasoline should only go in a red can designed for gasoline, and it should have a top and a pop-off valve. And it should never be filled all the way to the top. I see people filling gasoline cans all the way to the top at filling stations all the time. Don't do that. And this is why when gas in that can warms up, it expands. And you need to have it in a pop-off valve and not in some kind of bottle or anything else in which it could turn into a Molotov cocktail. The next thing you need to know is that a very important tool that you ought to be carrying with you is something I keep in my briefcase, and that's a flashlight. What you don't want to be doing is anything that could create a spark in an atmosphere that might have gas in it. And the gas could not be coming from your house. It might be coming from your neighbor's outdoor gas lamps that haven't been shut off. So anything that could create a spark, even a cigarette, could result in a serious explosion. And you also need to be aware that animals get displaced just the way people get displaced in tornadoes and hurricanes, and they may be taking shelter in what's left of your home. And these could be wild animals like raccoons or possums, and they're not necessarily scared of you, and they can attack. Don't approach any snake. It's very easy to mistake what you might think is a harmless snake as a potentially venomous snake. For example, a young water moccasin, which is a first cousin to the copperhead, actually looks like a harmless water snake. If you get bitten by a snake, remember that that could be a venomous snake bite, you need to see a healthcare professional. The most important thing to do is to wash the wound with soap and water. And the next thing you need to do is not panic, not run. The most important tool at your disposal following a snake bite are your car keys, because your car keys are there for you to start up a car and get to the closest emergency department so you can be evaluated. If you can take a picture of the snake with your cell phone for further identification, that would be important. Or if someone with you could take a picture. Now, I have a picture on my phone that a patient took, and it enabled us to recognize that he'd been bitten by a water moccasin, so we could start early aggressive anti-venom therapy. The treatment of venomous snake bites is not what you hear from history. You know, it's not making incisions, it's not sucking the venom out of the wound, it's not putting the wound in ice. It's basically anti-venom treatment, which is given in the emergency department in an intravenous, in an IV. But even a non-venomous snake bite, such as the bite of a black snake, can be a significant injury. Snakes have very sharp teeth. Venomous snakes have fangs, but all snakes have very sharp teeth, and even non-venomous snakes can inflict a pretty serious bite that can really bleed and that can be prone to infection. So in my opinion, any snake bite that's sustained in a disaster cleanup needs to be evaluated. The good news is that even venomous snake bites, not all of them are envenoming wounds. One of the environmental exposure risks, in addition to insect bites, from mosquitoes and red ants, for example, in which case you should be wearing topical insect repellent containing DEET or picaridin, is exposure to ultraviolet radiation from the sun. So you certainly should be wearing a hat, but you should also be wearing a sunscreen, and that sunscreen on your exposed skin, say the face and the hands, for example, your forearms, should be a sunscreen containing a sun protection factor, which is abbreviated SPF, which will be on the bottle or the tube, of 30 or greater. Remember all the flat tires after Katrina. The same thing goes after a tornado. So be on the lookout for nails, roofing nails scattered all over the ground and in places where you may not suspect them, because pieces of corrugated roofing, roofing nails, they fly everywhere. If you have not had a tetanus shot within the past 5 years and you sustain a puncture wound during a cleanup, you probably should get another tetanus toxoid booster. Most people recommend a tetanus shot every 10 years, but if it's a puncture wound and you haven't had one in 5 or more years, it's probably a good idea to get a tetanus booster. It's certainly not going to hurt you. First aid kits are always important to have, and they should contain Band-Aids, bandages, roller gauze, and a tube of antibiotic ointment. They should also contain wipes, sterile wipes, and soap, and you should also have a supply of water, either in your ice chest as bottled water, because any wound, even a minor wound, a minor laceration, any sort of puncture wound, should be immediately cleaned with soap and bottled water, and should have a topical antibiotic ointment applied, like mupirocin or bacitracin or triple ointment, which is bacitracin and polymyxin ointment. Disaster cleanup is a very stressful operation. It's stressful not only in physical stress and exertion, and increases the risk of musculoskeletal injury, particularly a fall from a ladder, for example, or lifting something that's too heavy, say over 50 pounds, that you should not be lifting without help. So that is called the physical stress. In addition, there's environmental stress, which is stress imposed by heat and dehydration. So you always need to take frequent water breaks, frequent cool-off breaks, have an ice chest with you with cold water, cold drinks, certainly not alcoholic beverages. And finally, another severe form of stress is really mental stress. So certainly you need to take frequent breaks, gather your thoughts together, maybe have friends come in and spell you for a day or two so you could take some leave away from the disaster site.